Assalamu alaikum wa rahmatullahi wa barakatuh. This is Azim Sayed, the chairman of the board of your Shura Council of Southern California. I'm very happy to be with you to remind you of a very important way you can make yourself and the Shura Council prominent on our ShuraTV YouTube channel. We're looking for more subscribers and folks that can make sure they are tuned into new content and get alerts for whenever we do new programming. This actually helps the Shura Council get better chances to bring you even better programming. So please like, subscribe, and share as widely as you can. As you know, ShuraTV is our YouTube channel that offers everything for the past, the present, and the future. We have faith-based programming, health-based programming, and pretty soon you'll see programming intended for our families and children. So we're covering all aspects of society and bringing you the best, but only with your support and encouragement and conveying that we can even make this an even more helpful and beneficial platform, inshallah. So looking forward to all of your subscriptions. Please help us get to our mark of bringing even more beneficial and helpful programming to the forefront of highlighting the Muslim Southern California community, which is all of you. Thank you very much.
Good afternoon. This is Dr. Zachariah. Greetings of peace upon all of you. Hopefully you're doing well. I wanted to welcome everybody to this show. We're here on November 14th today. I think it's Tuesday the 14th. And we wanted to welcome you and your into our show today. Today, we wanted to discuss a little bit about a condition that's very common in many people. And first, we want to start with dizziness and something related to it, which is called vertigo. So dizziness and vertigo, we'll get into the specifics of dizziness and the types of dizziness and the types of vertigo and what type, what people are doing for it, what your doctor will do, what some of the symptoms and signs are, and then what some of the causes are. And then as well, we're going to talk about some of the treatments with traditional medicine as well as functional medicine. And we might touch a little bit, if time allows, on functional neurology, because as you know, dizziness and vertigo are things that affect the central nervous system, or they come from different types of deficiencies or pathologies, possibly from the central nervous system. And typically, your doctor might refer you to a neurologist to go get that studied and see what the main cause of that is. Again, as I do normally, I want to encourage you to go get your boosters. California is now allowing everybody that has done their second vaccination more than 6 months ago to get the booster. So that's something very good. It's an extra layer of safety and precaution to go ahead and get it, especially if you're a senior or if you're someone who is immunocompromised. It would be a good idea to go ahead and get that booster. We also want to point out that there's a lot been said about boosters and vaccines and mandates. There's a lot of in the news that you see now that people are mandating. If you look at Europe, there's countries now that you have to have a vaccine in order for you to go into a restaurant or to go into public gatherings, because those countries are now experiencing higher rates of COVID again, and they don't want to go into a lockdown situation. So the best form of defense for the COVID infection in those countries right now, if you read about Europe, Germany, Switzerland, all these places, this is going on right now. So I encourage you to go ahead and get your vaccines and boosters, and also for your children that are 5 to 11, vaccines are out. Go ahead and get them. Getting back to our topic today. So dizziness is what we want to discuss first, right? dizziness, there's 4 types of dizziness, right? We have vertigo, which we'll talk about more in a bit. Vertigo is usually a sense of motion and spinning. Usually you experience yourself spinning or the room around you. So it's either yourself or the room around you. Then others have a symptom which is called disequilibrium, right? Meaning that you're feeling a little off balance. You're not feeling right. A lot of people with orthostatic hypotension or hypertension, where it's positional, they might get a little bit of disequilibrium. They get wobbly, unsteady, off balance right when they get up. The other thing would be lightheadedness. That's another type of dizziness. Usually you feel like you're not within yourself. You don't feel like you're in the setting that you're in. You feel kind of out of consciousness in that setting. You know what I mean? Not that you're knocked out, but you feel like you don't know where you are. You're kind of dazed and confused. And then, of course, we have pre-syncope, which is syncope means fainting. This is before fainting. The feeling that people get before fainting. That's something where you have an imminent feeling that you're going to lose consciousness and you're about to faint. Some people might get a cold sweat on the forehead. Usually, there are certain symptoms that are related to dizziness. These symptoms can come with a variety of pathology. The most obvious is anybody who has had any type of trauma. Trauma meaning that you're playing football, you hit your head. This will cause dizziness. People who are doing taekwondo or boxing or karate, these things, and they get a blow to the head. UFC now, there's UFC gyms, people go and fight. These kind of things where you're running and you hit the ground, or you're playing soccer and someone elbows you on the head. That's a head injury. Other people might get a fever, some type of infectious disorder, which is causing a fever, causing you to get dehydrated and dizzy at the same time. And then, of course, there's loss of consciousness. That's another symptom that you'll see with people who are dizzy, and then they get that. Also, people who have heart palpitations, that's another symptom that you'll see with people who are dizzy. Some people might experience chest pain, and others have shortness of breath, which is with trouble with breathing. And they might actually start breathing at a very fast rate, where the body's trying to compensate, where you're short of breath. So your respiratory muscles and your body consciously are going to try to breathe faster to get more air in, and that's known as hyperventilation. Some people might have changes in vision, also changes in speech. They might slur, or they might talk too fast or too slow, and you'll notice that they're kind of not functioning on that level properly in terms of their breathing and their speaking. And then the other thing is with stiff neck. A lot of people who say that they're dizzy, they do have the symptom of having a stiff neck. That's something that's there, and you need to look out for those things. So head injury, fever, fainting, loss of consciousness, speech or vision changes, stiff neck, heart palpitations. These are the things that you look for in terms of dizziness and the symptoms related to it. So let's talk a little bit about some common things that we notice in terms of what are the major things that cause dizziness. I mentioned one already. A lot of people that are on hypertension medications, whether it's low blood pressure or high blood pressure, there's a fluctuation. When there's that fluctuation in blood pressure, you might have that orthostatic, meaning positional dizziness that comes about. If you suddenly get up, if you suddenly move, if you suddenly do any type of movement while you're laying down and you get up too fast, you might get that dizziness. And you might, and that's something which is very common in people that are usually 55 and over, and you see this happening quite a bit, even in hospitals, where people try to get up quickly from their bed and they've been bedridden for a while, and they get up and try to walk, and they'll get that dizziness there. That's something which is common. And we want to make sure that when that happens, we have something to hold on to, or if we're a caretaker, we want to make sure that that bout is taken care of. So some statistics on dizziness, right? 4 in 10 Americans will experience an episode of dizziness significant enough to go see the doctor. Children, more than 1 in 20 US children between 3 and 17 have dizziness and balance problems. That's about 3.3 million children all over the US. Okay. 2.8 million people ages of 65 or older are treated in the ER for fall injuries, which are due to dizziness. Okay. Due to dizziness. The other thing that's most common is benign paroxysmal positional vertigo. Which is one of the most common causes of dizziness. Vertigo is a type of dizziness that occurs. And one of the most common causes is BPPV. BPPV. You don't have to know the word, but that's what it is. It's a type of vertigo, okay? 57% of patients seen for BPPV complain of poor balance, okay? A third of all those who are dizzy have BPPV, a third. So all the dizziness symptoms, people that come into the hospital for dizziness, 1 out of 3 of them will have benign paroxysmal positional vertigo. Okay, BPPV. This is a type of vertigo. The unfortunate thing is almost 60%, 58% of this vertigo, the cause is unknown. The cause is generally unknown. And this is where we get into, what we can do to help these people. One thing to do is on a functional level, I mentioned, the vestibular system and the neurological system, hence seeing a neurologist. There's exercises that you can do to improve your balance and your gaze, right? Your core balance, standing toe to tip, and then the hallway balance, right? These are exercises that you can look up and you can do if you suffer from dizziness or from vertigo. Now, this is a type of physical therapy, right? You can get evaluated for this dizziness if you don't know the root cause of it through a neurologist, right? There's a functional neurologist. They really get to the root cause, whether it's stemming from your the balance center, which is in your inner ear, or from the brain. So there's 2 different paths. They can check, the balance centers in the ears or the brain, where also controls your balance and your movements. So this is something where you kind of have to be an advocate for your health and recognize, what is the source of this, the source of that vertigo. So that's something, it's not like, okay, I had a bump, I had a fall, and now, I'm considering, these things, the origin or the root cause of it. You need to find that out. That's very important, right? So those are some of the things that you can do for that. Getting back to the blood pressure, blood pressure fluctuates based on your diet, based on your your peripheral arteries, what's going on in your body, what's causing it. You could have benign blood pressure where you don't know the cause of it, but there are things that people can do. Your primary care doctor can and will put you through a battery of tests to figure out what's causing that blood pressure and what's causing that vertigo. That's very important to clearly distinguish. The other thing that we want to make sure that we eliminate is dizziness is a side effect of some types of medications as well. If you're on multiple medications, if you're on more than 4 or 5 medications, or you're on a medication that's constant in your life, you might want to check that out and discuss with your doctors whether or not that medication has any side effects that can lower or increase your blood pressure quickly, or actually cause dizziness and vertigo, or have some type of ototoxic, meaning that it has some type of tendency to damage the inner ear. If it has that kind of toxicity, then it might cause balance changes, it might cause vertigo, it might cause BPPV, it might cause different types of dizziness, as we discussed that disequilibrium. Another issue that people usually report when they get vertigo or dizziness is a dental procedure within the last 4 to 5 days. They keep their mouth open in the dentist. These nerves are here attached and they strain the inner ear. And a lot of people sometimes they're sensitive and they post dental treatment, they'll get this dizziness or this vertigo. Also, some people post surgery, they get dizziness and vertigo, and that's a reaction to the anesthetics. Some people have sensitivities to anesthetics, and this is something to look into because a lot of these anesthetics that are used during surgery, they're safe in the long run and for the most part. But as people are becoming more sensitive and more reactive to their environment and to environmental toxins, they develop more sensitivities to these anesthetics. And these anesthetics usually, are safe, but typically what we want to do is try to eliminate. There's other types they can use. If you determine that you're allergic to one, there's other alternatives that they can use. So that's very important to keep in mind. And also, environmental toxins. Some people use uh, certain things near their eyes, near their mouth, their lipstick, things, powders that they use and they inhale. These things can also cause reactions which will cause disequilibrium, will cause vertigo if you have that sensitivity to it. So you have to look at all these environmental factors as well. It's typically, like I said before, two paths. Functional neurologists will take you and they'll try to distinguish between the brain origin and the middle ear origin. Middle ear, you have the things called statoliths, which are in a fluid in the middle of the ear, and they're responsible for your equilibrium. Sometimes those crystal little bones that are floating, the little crystals, we can call them for lack of a better term, um, they get lodged out of the system, and they'll cause a profuse vertigo where the person thinks that everything is spinning so fast they get nauseous, and you have to give them some type of antiemetic or anti-nauseous medication. So these things happen. You need to keep your eye on it and try to decipher what exactly is happening in terms of your environment, your anything new that you're doing, anything that you feel that might cause this vertigo. And if it's something constant in your life, then you have to look at those other functionalities of the inner ear and also the brain, and any type of um, past infections that might have affected the inner ear. Some people have reactions to long-term antibiotic use. So there has to be a full history taken. And then once that happens, then they might want to take some imaging as well. They might want to take an MRI or CT of the inner ear and the base of the brain to find out what's going on in those centers. All in all, you have to advocate with your doctor to find the source and the root of it. There's a lot of functional medicine doctors that can help you as well. And that's something where I would encourage you to do, because um, if you can eliminate the environmental toxins and count out all those things that we mentioned, there's no head trauma, there's nothing obvious that's causing this, then also hormones and hormone level checks, that's very important. The balancing of hormones, that's something to look into, because these things all contribute to the system of the body, which causes these symptoms of dizziness and vertigo. um, those are the most important things to keep in mind when it comes to vertigo and and dizziness in general. Um, you know, as again, the ear is the most important thing to check out. That's something where your doctor will refer you to the correct specialist. whether it's a neurologist or an ENT. But a neurologist will also check out, central nervous system to make sure that there's nothing wrong there in terms of abnormalities or pathologies. So those are the things to look at. You have to, eliminate the common causes, which we discussed, right? And then go and look into the biological and historical causes in your body that has to do with you. And all that starts with a good history and physical with your doctor. And you have to be vocal about it and focus on it and let them know so that you can achieve better health and better well-being. If you have any particular questions or any referrals that you need for particular doctors that can help you with vertigo and dizziness, let us know here, and we can get you some good practitioners that can help you and that can get you to overcome this pathology. With that, I'd like to wish you guys a happy week, and we'll see you next week with another topic on your health, and hopefully you guys stay healthy and safe. Take care.
اللهم لك الحمد أنت رب السماوات والأرض ومن فيهن، ولك الحمد أنت ملك السماوات والأرض ومن فيهن، ولك الحمد أنت نور السماوات والأرض ومن فيهن. اللهم لك الحمد كما ينبغي لجلال وجهك وعظيم سلطانك. اللهم صل على محمد وعلى آل محمد كما صليت على إبراهيم وعلى آل إبراهيم إنك حميد مجيد. اللهم اغفر لنا ذنوبنا كلها دقها وجلها وأولها وآخرها وعلانيتها وسرها. اللهم أنت ربنا لا إله إلا أنت، خلقتنا ونحن عبيدك، ونحن على عهدك ووعدك ما استطعنا، نعوذ بك من شر ما صنعنا، نبوء لك بنعمتك علينا ونبوء بذنوبنا، فاغفر لنا فإنه لا يغفر الذنوب إلا أنت. اللهم إنا نسألك من الخير كله عاجله وآجله ما علمنا منه وما لم نعلم، ونعوذ بك من الشر كله عاجله وآجله ما علمنا منه وما لم نعلم. اللهم آت نفوسنا تقواها وزكها أنت خير من زكاها، أنت وليها ومولاها. اللهم أصلح لنا شأننا كله ولا تكلنا إلى أنفسنا طرفة عين ولا أقل من ذلك. يا مقلب القلوب يا مقلب القلوب ثبت قلوبنا على دينك. اللهم حبب إلينا الإيمان وزينه في قلوبنا، وكره إلينا الكفر والفسوق والعصيان، واجعلنا من الراشدين. اللهم توفنا مسلمين وأحينا مسلمين وألحقنا بالصالحين غير خزايا ولا مفتونين. اللهم اجعل القرآن العظيم ربيع قلوبنا ونور صدورنا وجلاء أحزاننا وذهاب همومنا وغمومنا. اللهم اجعل القرآن حجة لنا ولا علينا. اللهم اجعل القرآن حجة لنا ولا علينا. اللهم إنك عفو تحب العفو فاعف عنا. اللهم إنك عفو تحب العفو فاعف عنا. اللهم إنك عفو تحب العفو فاعف عنا. اللهم إنا ظلمنا أنفسنا ظلما كثيرا ولا يغفر الذنوب إلا أنت، فاغفر لنا مغفرة من عندك وارحمنا وأنت خير الراحمين. اللهم اغفر للمسلمين والمسلمات والمؤمنين والمؤمنات الأحياء منهم والأموات، إنك سميع قريب مجيب الدعوات. اللهم انصر إخواننا المستضعفين في مشارق الأرض ومغاربها. اللهم انصر إخواننا المستضعفين في مشارق الأرض ومغاربها. اللهم كن لهم معينا ونصيرا. اللهم كن لهم مؤيدا وظهيرا. اللهم اختم لنا شهر رمضان برضوانك والعتق من نيرانك. اللهم أعد علينا رمضان مرات عديدة وأزمنة مديدة. ربنا تقبل منا إنك أنت السميع العليم، وتب علينا يا مولانا إنك أنت التواب الرحيم. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب. وصل اللهم على نبينا محمد وعلى آله وصحبه وسلم.